Good afternoon po ma'am. Here's my report and my topics: religion, spirituality, and adult lives. What is religion? An organized set of beliefs, practices, rituals, and symbols that increases one individual's connection to a transcendent others. Ma'am, ito po yung dapat natin organize ang ating practices para yung symbols natin ay magtaas sa ating kapwa-tao. Religiousness refers to the degree of affiliation with an organized religion, participation in its prescribed ritual and practices. Ma'am, ito po yung degree na dapat i-organize natin sa religion, hindi lang po dito sa lugar natin, kundi po sa buong mundo. Spirituality involves experiencing something beyond oneself in a transcendent manner and living it benefits in the society. Dapat tayong mag-experience ng pagdomina sa ating sarili para di lang tayo maka-benefit ng pangalaga ng pamalaan, kundi ang ating society rin. Spirituality and religion, powerful and influences for some adults but hold little or no significance for others, according to Richard Cruz and Hayward 2016, McAuliffe and others 2005. Ito po yung ang spirituality natin, ma'am, ay dapat maging powerful para ang influence natin sa iba't ibang tao ay hindi siya mag-error po, ma'am. In the recent national poll, 92% of US adults said that they believe God. 50% reported that religion is very important to them. Sa ating bansa po, ma'am, parang mas mataas pong national poll ng US sa atin, kumaga sa ating bansa. Di kailangan po ay mas importante rin po na ang ating middle age ay mag-become religious in always. Survey says more than 70% of US middle-aged adults say spiritually in major part of their lives. Increase in spiritually occurs between late middle adulthood and late adulthood. Few researchers center 90% of adults aged 90 and over report having religious affiliation. Study says 60% of women compared with 47% of men said that religion is very important in their lives. The spirituality of women increased more than of men in second half of 2002. In the second topic po, ma'am, religion, spirituality, and health. Saying, how might religion influence physical health? Some cults and religious sects encourage behaviors that can and damaging to health. Ito po yung religion natin, ma'am, na dapat ang ating behavior ay hindi makadamage sa kapwa natin, sa ating kalusugan. Might be means researchers increasing her finding spirituality, religion in a positive link to health. In a recent study, spiritual well-being predicted which heart failures patients will be alive for 5 years. Ito po yung sinasabi ay pinipredict nila, ma'am, na dapat still alive in 5 years pa rin yung patient po, ma'am. To conclude, various dimensions of religion and coping can help some individuals cope more effectively with challenges in their lives. Religious counselors often advise people about mental health and coping. To read about the work of religious counselors, see Connecting with Cares. Religion, spirituality, and coping. Saying, what is the connection between religious spirituality and ability to cope with stress? Study says, highly religious individuals are less likely than their moderate religious, somewhat religious and non-religious countries to be psychology distress. Ito po yung religious individuals, ma'am, na nagbaba siya in moderate religious kung saan siya tutungo po, ma'am, dapat psychological distress pa rin. Researchers are increasing finding that religion and spirituality are related to well-being. For seriously ill patients admitted to an acute care hospital, religious coping was related to low rates of residents going. Spiritual coping is often beneficial during times of high stress. In one study, spiritual support was significantly related to low rates of depression and high levels of self-esteem. Ito po ang mas importante po yung spiritual coping sa atin, ma'am, kasi during times of stress, di siya nakaabala po sa ating study. Kumaga, nag-support pa rin ang significant religious or high levels of self-esteem. Di po siya, minsan, inatake tayo ng depression, pero minsan lang din siya magdating. If it is found that where religion is an important aspect of people's lives, they are least likely to commit suicide and low level of depression. Ito po yung mas importante pa rin yung paniwala natin sa isa't isa, ma'am, kahit sa isang problema, ibang tao mag-commit ng suicide dahil naka-atake siya ng anxiety, depression, for example. Negative religious spiritual coping. Associated with higher levels of post-traumatic stress disorder among veterans who had been exposed to religious extreme during their lives in Iraq, Afghanistan. Dito po yung for example po, ma'am, dito po yung makita yung high na trauma natin kung kumbaga ma-aksidente po tayo, ma-expose po tayo sa mga gyera or digmaan. For example po sa Iraq and Afghanistan. Positive religious spiritual coping was linked to higher perceived post-traumatic growth of PPTG symptoms. According to Frank, in a spiritual of man, spirituality is not about religious but rather refers to human being uniqueness of spiritual philosophy and mind. Dito po yung spirituality of man, ma'am, kasi dito po yung ating makita ating uniqueness, ating